The president has spoken often about this so-called immunity in children.
Young people are almost immune to this disease. The younger, the better.
My view is the schools should open. Children are almost, and I would almost say definitely, but almost immune from this disease.
They're much stronger than all of us when it comes to the immune system. Children just are, I guess I heard one doctor say virtually they're immune from it. They have a very strong something, and they are not affected.
And doctor, let's continue on the theme of all evidence to the contrary. You know, notably, there were no physicians at today's meeting. It's been a long time since we heard from Fauci and Birx from that podium, just the president. So you and your colleagues who we depend on at this network have become, in effect, our public health experts. So with that in mind, with the troubling new evidence in mind from the president's own CDC on children, what is the effect publicly of hearing from our president that children are virtually immune and don't transmit it?
I think it's quite notable, Brian, that you don't see physicians standing behind that statement. When he first started using the terminology virtually immune, and I recall a reporter challenging him to say, "Who said that?" he brushed that off. And that's because medical professionals, as well as public health professionals, have been learning as we go along. The early myths that children were less likely to contract the virus came out of the reports from Europe, which did rapidly shut down and move children out of circulation once the coronavirus started to spread there. And when that happened, they prioritized testing those individuals with symptoms and testing those individuals who were on the verge of being hospitalized. And that is something that we had to do early on in the pandemic here when we had a shortage of testing. What has changed for us is the ready availability of testing, the number of settings and scenarios when children have come together, such as summer camp settings, and even those schools that have opened. And what we have found out, to our great dismay and concern, is that yes, children catch the coronavirus. Certainly a small proportion end up hospitalized, that proportion being roughly equivalent to that of the number of adults who are being hospitalized. And there are children who die. So to say it's an infinitesimal percentage, that's not reassuring to a family who has lost a child or who has suffered through the stress, the financial strain, and the emotional strain of a child who's been hospitalized with COVID-19.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.